I'm live. Hello, uh, Rethink Your Health fans, and maybe new listeners tonight on our 5 platforms that we're streaming live right now. My name is Tanya Abreu, and I am extraordinarily blessed to be able to do this weekly with you, really inviting the most amazing health transformative people that keep really being attracted to our media, right? Our channel, our growing family of people who know that health is not what we traditionally thought it was. And if we rethink it, it becomes something in some instances ridiculously easy to get to when you begin to stop thinking about health as punitive, stop thinking about health as um, negative and guilt laden and difficult and something that restricts you instead of inspires you. It becomes so much more easy to feel good physically, emotionally, spiritually in life. So welcome. It's August the 9th. It's the in our house, it's the night before a new school year. And it's particularly exciting because it's, hey, tomorrow is a chance for these young people to start fresh, right? To begin with new teachers and new classes and new books and new friends and new experiences to expand their life. And I kind of view that way with this young, wonderful, amazing nurse that we're about to interview and learn from. Her name is Kasey Pacheco, and she was introduced to me by Leanne Meyer, and everyone knows that's my once a nurse, always a nurse influencer. She's a mentor, she's a friend, and probably tonight she is a great identifier of resources for all of us to learn about how to be healthier and happier and more community centered than we currently are. So I am excited to introduce Kasey. Kasey is a registered nurse, but she also holds another set of initials. She is a holistic nurse baccalaureate. She is board certified in holistic health nursing, which makes for an amazing, amazing healthcare provider. So I'm going to put this beautiful energy on the screen. Good evening, Kasey.
Hi, good evening. Thank you for having me, Tanya.
It is our pleasure. I know that so many people responded with exclamation points that they would be joining us. So please, if you have any questions, welcome and please ask them of Kasey. Kasey, I want to really get right away into your background because we all pretty much know what an RN is, but I don't know that most anybody, including myself, exactly understands what a baccalaureate in holistic nursing brings to the table. Please introduce yourself, why you're a nurse, and what a holistic nurse actually is.
Absolutely. I've been a registered nurse for over 10 years, and recently, within the past 2 years, I became board certified holistic nurse. Now, a holistic nurses are not new. They've been around for about 20 years, but they are currently, like, a lot of people are being drawn to holistic, integrative, and nurse coaching. It's the same body that certifies all of them, the American Holistic Nurses Association. And what we do as well, my perspective from a holistic nurse is not just taking care of the disease or the symptoms, but really addressing the entire person, the whole person. It also references to holistic nurses. I remember you have to get a certain amount of hours of practice. And one of the hospitals I worked at, we actually did have a holistic nurse introduce a program of aromatherapy. So we were able to actually use some of the oils and some of the healing modalities at the bedside.
Fascinating. Now, let me ask you this. There's a couple of things we're going to talk about tonight. The title of our podcast is Self-Care as Community Care. And that's pretty it's pretty odd, right? It's pretty
Mhm,
unique, and we'll
mhm.
talk about that in just a moment. But let's just start at the highest level. You are, when I met you and when we kind of interviewed and talked together for the first time, you really said to me that the world is crying out for a new model of how to get healthy, crying out for a new way of doing things. And in the few moments that we had to chat before we came on the air, you mentioned that right now you're working as a coach to other nurses because they are burning out at a rapid rate. I mean, we just saw the statistics today on Becker's Hospital that 69% of nurses plan to leave the profession within 3 years. That's horrifying, right? Because we know nurses run things, especially registered nurses that have an awful lot of experience, kind of in between, specialized care and service. Um, what do you identify as some of the major flaws in our understanding of health, and what are you doing about them?
Oh, that's an excellent question, Tanya. Something I have been advocating for since the start of the pandemic is the way we were working as nurses was not sustainable to begin with. And you put it on top of this global health pandemic. It just was burnout ready to happen, waiting. And even before burnout was a thing, um, and in nursing, we have what is called a caregiver role strain, where we are not unfamiliar with caregivers burning out. We've known this for a long time. So I thought, in the middle of a pandemic, I also had a baby. How could I support my
Congrats.
nurses? Thank you, thank you. I was like, how can I support my nurses? Me just being one person. And that's where I came up with this model of community nursing, where I thought if I could get out into the community and support and strengthen the ones who are bearing the load, the ones who are carrying the heavy strain. And it's not just limited to nurses, but those in the healthcare field and those like our teachers, social workers, like the people that we deemed essential workers. I thought, well, if we could just invest a little bit of time in teaching them and supporting their preventative health care, how much that would help our hospitals, how much that would help people who really need the services, to have the people who are there to take care of them in optimum shape.
Okay, well, I love the definition, but I need you to get more specific.
Yes.
So, if you're helping essential workers carry the strain and help them with the prevention of burnout and getting sick, what are the top three areas that you need to work on? And I want to address this because I see people popping up on LinkedIn. It doesn't matter whether you're in healthcare or not. If you survive this pandemic, which obviously you have if you're listening, you were a caregiver, and you were a caregiver under extraordinary strain. And there's probably a very real possibility that you are experiencing PTSD, post trauma, after all you've been through, as well as true burnout of just being sick and tired of what needs to be done to just get through every single day. So,
Mhm,
having said that, you're addressing a huge population right now when you speak. What
mhm.
are the top three areas to work on? The top three things that you do with your clients to help us get out from under all this weight?
Yes, something I advocate very, very strongly is really engaging the parasympathetic nervous system to relax and rest. I also talk a lot about mental and emotional well-being because sometimes we don't even give that emotional context I talk a lot about emotions, even more so than mental, because sometimes it's easy to say, oh, I have mental health issues, or I have mental health problems, leading like depression and so forth. But a lot of times, emotionally, we're not okay. And I know it from experience, because as a nurse, I remember working and went working way past when I shouldn't, because I just couldn't say no. I wanted to be that caregiver. I wanted to give until everything was okay, and it never was okay. And emotionally, I gave and gave and gave, and it just was too much. It was too much. And I'm sorry, did I cut you off?
No, no, I just, yes, I understand. I understand what emotional health is, but can you talk to us about parasympathetic? That's a new.
Absolutely. Absolutely. So the parasympathetic system, right? So we have the fight and flight in our nervous system. We have fight and flight, right? Which most of us, we are all always on the go. We're always stressed. Just go, 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 go. The opposite of that is the rest, relax, digest. And this is something that in and I'm sorry, my brain is kind of frazzled tonight. It's a little past my bedtime. But the in the parasympathetic nervous system, you have what's called the vagus nerve. And the vagus nerve, what that does is that it controls so much of helping us actually relax and rest. And from that space, we can act. From that, when we there's so many things that stimulates the vagus nerves, such as humming, right? Meditation, grounding. Sometimes I take my clients outside just to get some fresh air, just to be in nature, right? We are electromagnetic beings. So when you get outside and you put your feet, the soles of your feet on the ground, all these things, people think it's little, but it's so much for our entire body, our entire system, to actually reset and
Mhm.
rebalance.
I love that. So you're saying that you will actually go to a client, take them outside, put their feet on the ground, have them breathe, and this kind of then relaxes the parasympathetic nervous system.
Yes, ma'am. Yes,
Okay. Now, what
yes.
about emotional strain? Okay, though that's very sensory based. Breathe in, put your feet on the ground, feel the power of the earth, relax your, your kind of primitive stress.
Mhm.
What about the emotional nature of things?
Mhm. And I think the emotional part, I think that usually takes some time with the clients, but building trust and allowing people to just express themselves, just to express their thoughts and their feelings. Sometimes I know some of my clients are social workers, and sometimes they are dealing with very, very traumatic experiences, and they don't have anyone to share it with, where it's not going to be burdensome. So I allow my clients to express their emotions, and sometimes, depending on depending on where they are, I say you can have like emotional constipation. So you may have to first you may have to first identify what the emotions are, and
Uh-huh.
and 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 sometimes that takes a little while, because some people, they never identified their emotions before. So teaching them tools and techniques of how to identify the emotions. And I encourage affirmations, positive affirmations, that really will bolster, just after they express themselves, they can have the positive affirmations to retrain their thought process
Hmm.
of how they feel, so that their feelings don't become their identity.
Hmm. Well, I put this wheel up because you talk a lot about self care, and we're going to talk about self care as the precursor to improving our community. This wheel, I think, is very, right now I'm going to very quickly go here and try to remove this. Let me hide this. Okay, so let's talk about what we're seeing in this wheel. I see personal, professional, physical, psychological, emotional, and spiritual as realms of self care. Is there any one of these that you feel have the most negative effect and the one that we should pay most attention to as we really begin to care for ourselves? Most of us think of self care as going to get our nails done, or taking a nap, and those are, and or reading a book, and those are, very, I think, good manifestations of these. But I think these are broader categories that I would love for you to talk about.
Absolutely. I think that, and just a glance at your wheel, I think the one that I really stress is the professional self-care, setting boundaries, especially as nurses, we have a hard time taking our breaks, using the bathroom, just those little things. Sometimes we think self-care is a day at the spa, but
Mm-hmm.
it might not always be such a drastic action.
Right.
For
Right.
some people, self-care is as simple as taking a break,
Mm-hmm.
getting a meal in for the day.
Mm-hmm.
So I definitely would say professional self-care is one that is really underrated.
I
Um,
love that. Learning to say no, right? It's taken me
no,
decades and decades to
uh,
learn to say no, because, everybody wants to be liked. That's a part of certain personalities, certainly mine. And you just say, okay, I can squeeze this in, I can squeeze that in. And what it does is it squeezes the life and joy out of you and the health.
yes, it
Yeah.
does. It
Yeah.
does. And I think that this is something I talk to my clients about because I am going through this process. I don't say that, oh, I am self-care queen. I am constantly learning how to set healthy boundaries and how to say no, and how to advocate for myself. So as I go through this process, there's a level of vulnerability and authenticity
Mm-hmm.
where we can share. It's not like I am just telling them what to do. I too have to practice what I preach.
Mm-hmm.
Mm,
Yeah, and I like, we talked about emotional as being really important to your clients and to all of us. I love the suggestions in this wheel. Find a hobby, put your
mhm,
emotions into painting or writing. Say I love you. There's your affirmations,
mhm, mhm,
Um, I used to make fun of, remember Saturday, you're younger than I considerably, Kasey, but Saturday Night Live, the comedy show, used to have somebody that stared in the mirror, and it was really tongue in cheek, and said, God knows you're beautiful, you're kind, I like you. And it was kind of funny. But I also find myself, as I'm facing grief or something else, to be able to say things like a mantra over and over again. Those are affirmations,
mhm,
And sometimes, there's very powerful, it's Jackie Chan that said, what you say, even joking about yourself, your brain doesn't understand sarcasm and cynicism. And you have to spell it out for your brain. That's what a casting a spell is about, right? You are powerful. You deserve more. Instead of, yeah, of course I got betrayed again, right?
mhm.
The brain really just, latches on to those things. That's a part of self care, is learning how to talk better about yourself, right?
Absolutely, and if I may interject, Tanya, also, I really talk a lot about the power of music.
Oh,
So what I've been advocating for is using music to heal.
wow.
Using music, because music is it's a universal language. It surpasses words, and I've been using singing affirmations, and they stick. Because if you think about it, if you have a tune to your favorite song, it sticks in your head throughout the day. So just imagine if you implement some singing affirmations in your morning routine. It sticks in your head, and all through the day, you have beautiful thoughts about yourself playing in the background.
It's funny. I early in life, I had a young cousin who was seriously autistic, right? Couldn't talk to people, didn't make eye contact, any of those things. But when they were about 4 or 5, they discovered singing. And when they would sing a song as simple as "Row, row, row your boat," they were as normal as any child on the planet. And, I am blessed to be helping to raise a child that's on the spectrum as well. And when he is able to write music, hear music, turn music up, it controls every burnout
Mhm.
that is there from overstimulation. So that's wonderful, wonderful, wonderful advice for sure. And the research is there, right?
Yes, and I think that's the thing that I really love about my job is that I get to have so much fun because the very things that we need to help us to stimulate our parasympathetic nervous system, like humming, that vibration, it really helps the body calm down.
Mhm.
It's the things that we do when we're having fun, singing. Also movement, movement is not always cardio, sweating, but sometimes dancing, moving to a specific rhythm, it helps.
We have Dr. Hampton on. Thank you. I love my LinkedIn family. Huge fan of affirmations. I regularly encourage my patients to reduce self limited thinking. And it's not just the thinking, Dr. Hampton, it's the words we use. I did it today. I'm not going to be able to make this happen.
Mhm,
And I caught myself,
mhm,
right? What a limited way of saying that. Or I posted something as well, that I said, you have to get up every morning and say to yourself, I think I can, or I am going to. But someone corrected me and it says, you get up every morning and you say, I'm doing this, right? It's kind of like the Nike, just do it. So thank you for that feedback. It's extraordinary what our own language can do, and yet oh my gosh, what we do to kids, right? Or how we allow kids to talk about themselves, and it just happens at a very early age. So that's fantastic. One of the things I wanted to point out to people who are listening, and now that we have a medical doctor that I know is on the line, it's really about how there's been becoming a real shift in professional roles, medical healthcare provider roles. Maryland, the state of Maryland just put out healthcare workforce mandates, and they're scary. They're like horrible, right? We've got the shortage, we've got the burnout. Nobody wants to be a doctor, nurse, or any kind of provider anymore. But one of the suggested solutions is find a different way for physicians and nurses to practice, right? Find a different way. Talk to me a little bit about nurse coaching. We know that there's a nursing shortage and of 1.6 million nurses, RNs, LPNs, NPs. We know that doctors are leaving 1 in 3 within the next 5 years. Where are some new roles? I mean, our country is more sick than it's ever been. Chronic disease is up, obesity is up, diabetes is up. We're expecting twice as many dialysis patients in the next 5 years, from 800,000 to over 1 million. What's going on? And what is a new role for physicians and nurses in that?
that is, you hit the nail on the head, because there are so many new niches popping up. There are roles for to become a patient advocate. Like, I'm serving the community, but that's a very broad field. I could serve my healthcare workers. I could serve just business professionals. There are so many different ways that we can we can create changes in the way we practice. And for me, I'm a very big proponent on preventative care, because in the health and wellness space, there's even a title where people can be health and wellness coaches. They don't even have to be necessarily a doctor or a nurse to help someone preventatively. So there's a lot of things happening in this health and wellness field to help people even manage chronic diseases. Some nurses, they form their own chronic management cases, caseloads, where they would partner with doctors and they would follow up with these patients. So there's a lot of different room for growth. I think the thing about it that is difficult, especially when you get into a holistic field, is that even though many people know that holism works, coaching works, this is very helpful. The people go in the next direction with all their numbers and everything. Payment is still an issue. Most of us working out here, we private pay because it's not reimbursed by insurance.
Well, it
So
seems to me that that's the real need is
yeah.
research and how chronic. I mean, now Medicare, I know a whole lot because I'm working as a part of a company with remote patient monitoring that Medicare pays as a part of chronic care management. And, we're adding this dimension of social determinants of health and mental health on it. But there still is not a code for me to turn this person over to Dr. Hampton or to you, Kasey, and say, work with this person like I would with a psychiatrist or even a psychologist and say, over the next 12 weeks, help them change their life.
Hmm. Yes. And patients would love that. They would love that because they need the support. They really would like the support. It's just the system is not built like that. But hopefully we can get things changed.
Absolutely. Now, we wanted to talk a little bit today about this whole idea of self-care contributes to community health. Can you comment on that important central concept to you, Kasey?
Absolutely. I was raised around the thought of, you do good to other people. You take care of, you love other people, right? Like you love
Mhm.
yourself. And it dawned on me that myself is the standard of loving other people. So
Mhm.
as nurses, a lot of times I can tell you, I've had many stories of not taking care of myself. And I thought, well, if I go to a hairdresser, right, and the hairdresser is the standard of, okay, they do really good work, I'm thinking, well, they should have some of the prettiest hairstyles out there, right? So if I'm a healthcare provider, I should be one of the healthiest people in the community. All of the providers should be. But the reality was really different. The reality of the way we care for ourselves, we actually are not some of the healthiest people out there. And I thought, well, if I want to be a proponent for better health outcomes, it should start with me.
I spent a couple of days in the hospital having tests done because I was having odd undiagnosed spikes in blood pressure and a few other things. And thank God, I'm super healthy, but I don't deal with stress very well. But what was amazing to me is like these people would come in to give me advice, and they would be the last people I would take advice from, whether it's living, with, losing weight or just kind of living more joyfully
Mhm.
or taking more walks or breathing or, I had a neurologist come in who was very obese and had like almost no hair. Now I mean, I know that it could be all kinds of things, but a lot of the time it is from stress and, hormone imbalances. And, she was talking about get out in nature. And I'm like, You're like, take a walk, breathe deeply. I gotta go. And it was the things that she's trying to be cool, right? But you can tell she's not cool in her own life,
Mm.
and I wanted to put on my coaching hat, but I needed to be coached, right? I needed
Yeah.
somebody to help me. And you're absolutely right. So it does start with us, right? So community health and good patient care starts with the provider embracing those things, right?
Absolutely. And it's a lot of it even on my journey to coaching nurses and other healthcare providers. Um, had to realize I needed to learn myself how to go from doing to just being. And as simple as that sounds, when you have always been on the go, 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 getting into meditation and just being, just learning how to be present in the moment. It's one of the hardest things to do. A lot of times you feel like I need to do something, and usually when I start off my sessions, I started off with some breathing exercises and meditation because your mind has to shift. Where in the in clinical practice, your nurse, she's doing, so you're checking your blood pressure, you're checking, standing on the scale, there's a lot of doing happening. And so right off we start off about how to just be and how to just breathe correctly.
And that's amazing because all the terrible moments in life, and I know we've said this before, but we have to repeat it over and over again. All the most terrible moments in life, we breathe shallow. Except,
Mhm,
of course, when we're having a baby. That's a beautiful moment, right? That's how we control pain. But it really is your body's response to pain. It's not a calming thing. It's a way to get through
mhm,
horrific situations. But most of
mhm,
our lives require deep breathing. And I remember a really simple exercise, and I'll share it with everyone that's listening, and that is when you feel that stress, whether it's your kid that's getting in trouble, whether it's financial, whether it's you feel like you're going to be laid off. I mean, some of the most amazingly solvent companies are just announcing layoffs this week. But having said that, you know that pinch. It's not a pinch; it's a punch. Goes into your tummy. And the one thing I learned was take one finger, cover a nostril, and breathe in as deeply as you can. Let it go through your mouth, and then just keep doing that. And you understand how much breath you can take in through one half of your nose and
mhm,
let that out. And then all of a sudden, when you have both of your nostrils open, it's like 20 seconds of inhaling and 10 seconds of exhale. It's amazing. And when you just play with that cycle, even
mhm.
if you're driving in traffic, it's like a Xanax. you know, it's like an immediate sense of calm, right? It's pretty awesome. I put something up, and I love what you said about healthy as a mind shift,
Mhm,
because so many of us go to a doctor and say, give me pills, give me insulin, give me Xanax,
mhm,
give me something, because the last thing you think about is your mind, right? You
mhm,
think about something external doing something to you, whether it's a medication or give me a bunch of tests because something must be wrong,
mhm,
right?
mhm,
But when you just captured that so eloquently, Kasey, that healthy is a mind shift and a mindset,
mhm.
that's really cool. I think you mentioned mindset earlier. Do you want to define that for us?
Mindset has a lot to do with your perspective, and there are a lot of different mindset mindsets that people have, or I like to say that we tell ourselves. We all have like stories in our mind that we're telling ourselves what is really happening. And I think the stories that we're telling ourselves, we don't realize we're actually living it out. That becomes our reality.
Yeah. Yeah. And
Mhm.
it's the power of language, right? It's the power of influencing ourselves with our own stories. And we play old movies all the time, right? You meet somebody, they look like somebody, they say things, and the movie starts playing in your head, and you forget to see the new experience, right? So,
Abs-
wow, wow.
Absolutely. You were talking about breathing techniques. I like to teach the 4-5-7 method. That's where
Oh,
you breathe in for 4, you hold it for 5 for the count of 5, and then you breathe out for the count of 7.
all right. You're going to have to demonstrate that for us. Can you
Sure.
do that for us? Because that's really helpful.
Sure. So you breathe in 1, 2, 3, 4. Now you're going to hold for 1, 2, 3, 4, 5, and slowly breathe out for 7. 1, 2, 3, 4, 5, 6, 7.
That's hard.
It
You
is,
want
but
to rush through all the different things. Yeah.
but as you do it, for 2 minutes, sometimes you could go, there are certain, apps or timers that you could put on. You do it for 2 to 3 minutes, you will notice a shift in your body. It's like you got it's like I gave you Xanax to calm down.
Hmm.
And
Hmm.
the point is you're breathing out for a longer time than you're breathing in.
Wow.
And
Okay.
then you're making sure you have that nice pause where you're holding your breath
Yeah.
in
That's
between.
that's very cool. That's very
Or
cool.
5-7 method. Another method I would say if someone is like having a panic attack or anxiety meltdown, it's the 4-4-4 method. So that's you breathe in for 4, you hold for 4, and then you breathe out for 4. That's called box breathing.
I'm putting that up for those of us, so few of us, that experience anxiety for sure.
Yes.
So I wanted to ask you, I always like to ask people that have clients, without names and everything, can you talk about a patient or two that you are so proud of what happened to them, their testimonies with you working together?
Absolutely. I think, and this actually allows me to talk about something that we hadn't really talked about yet when it comes to holistic wellness. So, one of my clients, she graduated, and I was just really proud of her because a lot of our sessions, we were it was amazing, Tanya. We were able to integrate not just the physical, emotional, and mental aspects, but also the spiritual aspects of health and wellness. And we had such a beautiful session. Our last session, it was just amazing. I can't fully verbalize that when you involve the spirit, and it's not necessarily religious, but when you involve their spirituality, and you use I use music, or you use whatever processes that they feel most comfortable with, energy work.
Mhm.
It's amazing to see the transformation happens. And I said I'm sorry. I usually say spirituality is it's a little secret tool, because your clients, when you get them engaged with their spirituality, the changes they make is very, very rapid.
Okay, I need you to be more specific.
Yeah,
So
I'm
you did talk about, I mean, is it faith? Because we know that faith is such a powerful thing. Is it, in some people, it's traditional Christianity or animism? I mean, how would you define spirituality as a healing force?
yes, so definitely I would say spirituality is the connection with the spirit.
Okay.
So whether it's their traditional Christianity, and some people, they are traditional, but even and I don't mean to offend anyone, but even someone can attend church or sessions and still not get that connection with the spirit. So when I assist clients, I try to let them lead. That's a big thing in holism. The patient, the client is they know themselves and their body, and I try to let them lead and really ask questions to discern what is most powerful for them in making this connection. For some people, it's the music. They have their hymns. I allow them to say their hymns. For some people, it's they work a lot with energy. So allowing the allowing your energy to be to raising their vibrations and raising the energy. I don't know if you heard about a sound bath. Some people, they burn sage, and it clears their field, so it's not negative. It
Mhm,
brings like really positive vibes into their
mhm,
atmosphere. So whatever it is that works for them personally, everybody is different, but I think really keying in on what works for that individual and
mhm.
using that as part of the sessions, incorporating that as part of the sessions.
That's wonderful. That's wonderful.
Mhm.
And I've heard everything from, I was at a hospital years ago when I had a network of hospitals in women's health, and it was a hospital in Colorado that had sound baths. And this was every bit of 20 years ago, where they would go in with chimes or brass instruments, and it was pretty awesome. And it wasn't like all the granola people either that wanted this. It just felt good. And it's funny, spirituality can be like dancing as an expression
Mhm.
of your spirit. I was looking at the dancing neuro physician assistants in neurosurgery. Adkins is the last name. And he dances with all these patients. Some of them are, post surgery children laying in bed, and all they can do is kind of dance with their eyes. But when you watch this man joyfully dance, you understand that he's connected to his spirit, and his dance is a prayer for these suffering children. And it's connecting, it's clicking with me, because that's one of the things that healthcare is missing, the spirit. And um and you go into a okay, so you go into a pediatrics. I go to the pediatrician with the kids, and it's wonderful. There are clowns on the wall, there are some nurses in these lovely outfits, there's a pediatrician that wears the clown nose, and everybody's laughing, and there's water falls, and there's fish tanks. And then I had, 4th-stage cancer, and I go into an oncologist office, and it's all wood and dark, and it's like, oh, am I dead already? Where's the spirituality there, right?
Yes.
Where's at least a fish tank? Give me life, give me spirit. Man, that is something that just clicked for me right now. That's
Mhm.
important. With any model going forward, coaching with a doctor, coaching, and I've some of my best coaches, and believe me, I believe, and quite literally, nurses will transform healthcare in this country. But I've some of my best coaches have been my doctors. The gynecological oncologist that finally treated me, she was a life coach. She put my sexuality, my spirituality, my faith before my cancer.
Mm.
I can't explain the depth of how she addressed cancer, right? And she was an oncologist, a Johns Hopkins trained oncologist. So they're out there. And how do we bring them into this new healthcare model? And one of the things that you promote is, healthy communities and social determinants of health. You are a community nurse collaborator. Can you tell me what that is?
Yes, so that's basically. I invented it.
Oh,
But yes,
congratulations.
I invented that position, and basically what it is, I realized within the community, we just didn't have an independent nursing presence. So I work along with a lot of the nonprofits who, a lot of the churches, they give out food, and a lot people, they have needs and they have problems and they don't know where to go. They don't know who to ask for help. And so within the community, I work along with many of these nonprofits to try to connect the dots to get people the help that they need because um, that's something I always felt insufficient as a bedside nurse, where I didn't know what was available within the community for the clients. You tell them to eat better, but then they're telling you, I don't have a place to live. I don't know where I'm getting food, all these practical things that people need help with.
And it's increasing,
It
right? And
is.
it's not these poor, uneducated people, those darlings that have been faced with social inequities and injustice that are just suffering. It's middle class.
Yeah.
Look, about a year ago, I met a woman with 3 kids who were dropping off her kids at school. And I saw her go back to a park where I was going to read. And as I watched her clean out the back seat, I realized that she was living in her car with her 3 children. And I didn't want to be like nebby or nosy, but I'm naturally a helper. And I went and I said, "Hey, can I help you?" Because she was moving stuff around. And she looked at me and she said, "I don't even know where to start." And she had lost and could not come up with 3 months rent, or how it is when you need to rent. She was working 40 hours at a $10 an hour job. Her husband had moved on. She had no idea where he was. It was post pandemic stress and awful. And we just sat there on a bench and clicked through the phone and found a program in Palm Beach County that did provide people with rent, and first month, last month, and a first month's rent, and that's all she really needed to get out of her car. But I'm
Mhm.
sorry, this is not a woman who she was college educated. She had been a legal assistant before she got married and had these kids. And man, I just realized there's so many of us, and there but for the grace of God. And when we're taking a look at something called community health, and I took this social determinants of health, right? Because honestly, just my God, it has to be about what's going on in your life. If a doctor says, well, make sure you take your metformin and you don't eat carbs and you don't, and you're right. If you don't have a place to live and you're living in your car and you've got $10 a meal for yourself and your children, the last thing you're thinking about is my kidneys are going to fail. You're just thinking about how to get through that day. And so I put this up because I thought this was a really cool thing for you to talk about, because I know that this collaborative nurse healthcare model is really important to you. This is a social determinants of health from the CDC. And if you look around, it's kind of what pops up at you, Kasey, is areas that we're not working in that we should really look at a little more strongly.
Yes, I really see the social support networks and the income and social status. Both of those are really tough right now. Um, there are networks, there are a lot of resources within the community. What I find is that usually the resources, they don't talk to each other and they don't connect. So you may have to go
Ah,
one place to get help for one thing, and then you go somewhere else to get help for something else. And a lot of times, with income and social status, you already have the stigmas that come from trying to get help. But even with the system currently, me being in the community, what I see is there are people where you can fall through the cracks where you are too rich to get assistance and too poor to survive.
Yeah, and I've
And
been in that situation in recent years. I
yes,
ran out of
me
healthcare
too.
insurance,
Yes.
and I went to a clinic one day where I was treated with such disrespect
Mhm.
that I would rather not have waited around to get metformin and my A1C tested than to sit there a moment longer and to feel like I had no relevance in life anymore, right?
Yes.
So when you look at these two little green circles that talk about social status, if somebody doesn't have money, it doesn't mean that you treat them as if they are invisible. And
Mhm.
that's how I felt in that clinic system. Yeah, pretty
I
crazy stuff.
I don't know if you ever had to call social services, but you can't even get on the phone with someone. And, I have had so many community members saying, that their children's benefits are running out and they don't know what to do because a lot of these things are automated now and you just call in. There's no
Or
person.
everything has to be done online. And
Yeah.
so, how do
And
you
you
do
can't,
that? If you're an
and
older person and you can't hardly see your phone or you don't have a smartphone, it's really becoming more and more restrictive to get help. And you're absolutely right.
yes, I actually marched down to the center because there's a center where they provide computers and they can help you fill out forms and everything. And so I was one of the pastors, asked me to help out someone, and I was down there, and the lady was so rude. And I know the system. I know the system, and she was not helpful. And I said, "What happens to people who don't speak this language? What happens to people who are dealing with their own fears, their own shame, and what happens to people who do not know how to advocate for themselves? They don't even know what to ask. These people just fall through the cracks."
Wow. And that's why our hospitals are overrun with everything from, nervous breakdowns to suicide attempts to, serious end of life types of chronic disease. What you said before, I'm going to put up on the screen because I think it's pretty brilliant. And you said you invented this term about being a collaborative community nurse, but the whole concept of integrated system, government is giving mouth service to that, right? We have to integrate, we have to align, we're too disjointed. But if there was a way for Medicare, Medicaid, and even commercial insurers to pay nurses to navigate systems for people who are falling through the cracks, to keep them out of the ERs, even to navigate this. I can't believe that we just declared monkeypox a public health when fentanyl is streaming through the streets here in South Florida. I don't think I will meet anyone that's going to die of monkeypox this year, but I bet you there's going to be a dozen or so deaths in my community, right? And yet to solve that problem takes a lot of you, Kasey, takes a lot of collaborative nurses, takes pain control, takes mental health, takes children and youth services. It's mind boggling, but I've been talking, and Leanne, if you're still on, an amazing, amazing woman out of Austin, Texas, by the name of Candace Escobedo, who did a huge social determinant of health program with the church Methodist there. And the what she got for everybody, whether they needed money or whether they needed to understand their healthcare insurance, whether they were, regardless of their social economic status, their lives improved by collaborative, aligned care,
Mhm.
right?
Mhm.
So,
That
yeah.
is that's amazing. I often think about this because I saw that the government is trying to put a lot of initiatives to help the system. Something that I've noticed is in doing the work that I do, to really be effective, you have to get out of your ego and be in your heart space. And when you are public health, most of the people working in public health, they're doing the best they can. But the framework of it, it's really hard work. You have to really be out there speaking to the people, loving on the people, working with the people who may not necessarily be the ones that in a job description may require you to engage or interact with. And I really feel for the public health workers because there are so many charts and data and meetings that they have to attend and keep up with that it really takes them away from dealing with the issues and listening to the people and finding the connections and help for the people to actually make an impact in the community.
I yeah, that's powerful words. And we're getting ready to say goodnight to everyone, but I think I want to take that message and tell every healthcare provider that listens to this now or in the future that it's really important for you to get out there and try to become a part of a service model that's collaborative and rises above, insurance divisions and aligns with equity, because that is the future in healthcare. There will always be, just like in Canada or Germany or Sweden, a cash pay model that most people can't access. But there is a basic model that we can improve, and we can decrease instead of 50% increase dialysis, right? I mean, that's when I heard that, I was just appalled. We know exactly how to reverse kidney disease with proper diet, exercise, nutrition. I mean, it's just an abomination that we can't just step up, save money, and get paid. That's the problem, right? Because doctors, nurses, hospitals have not figured out how to get paid for a healthy patient. And that's what we're all swimming around and figuring out how to do now. I'm going to ask you the question. It feels rushed because we just have opened up this beautiful box of problems that we have some emerging solutions to. But here's the question, because this whole issue is about rethinking health, and I guess I will ask you this. Fill in the blanks, Kasey. I used to think that health was blank, but now I know that health is blank.
Oh, I love that. I love that. I used to think, I used to think that health was the absence of sickness. But now I think health is life.
Oh, oh, and the energy to live it, right? And the energy
Yes,
to
and
live it.
energy to live life.
And you have it. That smile, you have one of the most infectious smiles. I think that should be a prescription, is to sit with Kasey and watch her smile and laugh and listen to that rich island voice, and really believe that health is possible for you. Um, I want to thank you very much for being here. For those of you that came on late or had to leave early, this podcast will be available on Rethink Your Health with a UR, that is on YouTube, along with, this is episode 39. So, along with previous episodes, but it's also on whatever social media platform you're watching this at. It just scroll down and you can watch it, scroll through it, read the bottom comments. But Kasey, I really look forward to working with you beyond this podcast, and to really understanding how we can collaborate to
Mhm.
make ourselves healthier along with our community. I'll let you say a few words, and then we'll say goodnight to everyone.
Yes, thank you so much for having me. Thank you for all that you do within the community, and I wish you success
And health.
and health and energy.
Yes. Thank you so much. And thank you, everyone that's joined us. Leanne, in particular, you are the glue that holds a lot of our future together. Take care and good night.
Good night. Thank you for having me.